Hello, and welcome to California in Focus. I'm Eliana Kernodle, Assistant General Manager for America's Talking Network. And joining me again today is Kenneth Schrupp, California reporter for the Center Square. How are you, Kenneth?
Hey, I'm doing well today. Thank you for having me on.
Thanks for joining us. So, California lawmakers reintroduced a proposal to mandate universal health care. Tell us about it. Who proposed it and what does it do?
Assemblymember Ash Kalra, a Democrat from San Jose, introduced a bill to create a single-payer healthcare system and ban private care. Everybody would have to be paying into and in this system. It's not really clear how it would be funded, and it would cost about $391 billion per year, which is $100 billion more than the entire 2024-2025 state budget.
Isn't there already a deficit within the budget?
Yes. This year, the State Legislative Analyst's Office, this is a nonpartisan state-run analysis, found that we have a $68 billion deficit likely for the 24-25 fiscal year. So there's really no way that we can afford to more than double the budget without massively increasing taxes. There's a couple variations on how much this bill could ultimately cost. If we can't use federal funding, it will cost about $500 billion a year. If we can use federal funding from Medicare and Medicaid and we're granted a waiver to use this, it will cost $300 billion a year, which works out to about $12,500 in extra taxes per household.
Why was this bill rejected before?
The Speaker of the California Assembly shelved this bill last year because there's no funding mechanism for it. I think a lot of lawmakers in California, even progressive Democrats, are wary of adopting proposals that will raise taxes to such a high degree.
Have any changes been made in the bill to address these concerns?
No, not really. Kalra's plan seems to be, and he said this, is to first pass a bill that would require this to happen, then get the federal government to tell California how much it's going to be able to provide via Medicare and Medicaid funding, and then go back to the legislature to try to get any extra funding that isn't going to come from Medicare and Medicaid. And I just don't see any way for this proposal to move forward even now.
A related bill, Senate Bill 770, passed last year. What was that, and why did Representative Kalra oppose it?
State Senator Scott Wiener, one of the progressive leaders in the state Senate, passed this bill, SB 770, requiring the California Health and Human Services Agency to start talking with the federal government on how a single-payer healthcare system could be created that uses federal Medicare and Medicaid spending. This would give California a much better idea of how much money it would need and what kind of waiver it would need from the government to use funds for this system. It is probably a much more concrete way of moving forward with universal health care than what Kalra is proposing. And that is why he opposed it. He thought that if we engage in discussions with the federal government instead of just moving forward with adopting a plan, that will delay adoption of universal health care for a few more years. But at the same time, these discussions are probably going to allow a better fiscal picture of California to emerge as we face several years of major deficits. It does seem possible that even voters in California might not be willing to stomach such major spending increases.
If this bill were somehow to be passed, how would this policy likely impact Californians, in addition to rising taxes?
I talked with Pacific Research Institute President Sally Pipes. She's a healthcare expert that really is one of her top fields of focus. And one thing that we really noted was how much of a doctor shortage we already have in the state because Medicare and Medicaid reimbursement rates are so low compared to the cost of living and what can be earned from accepting private healthcare insurance. Doctors accept this as sort of a loss, but do it because they feel that people do deserve access to the care and services they can provide. But this is all subsidized on their bottom line by the private insurance that they still accept. Pipes pointed to Canada, where private coverage is outlawed and the average wait time for seeing a primary care doctor to getting a specialist takes about half a year, 27.8 weeks. We also can look to the increase in Medicare and Medi-Cal users as a result of illegal immigrants being granted access to the system. Just starting January 1st, we started allowing illegal immigrants under the age of 55 to enroll in Medi-Cal. There's going to be another 700,000 people on the system at least. We don't actually know how many illegal immigrants are in California and how many will sign up for the program. It could end up being a lot more people. This is going to cost billions of dollars a year. I think just this one expansion to 700,000 people is expected to cost $3.4 billion. It'll probably end up costing a lot more. Compounding that is raising the minimum wage for healthcare workers to $25 an hour. That's going to cost California government another $4 billion a year, probably more, because we're going to keep increasing utilization for services as people get older and sicker. Our obesity rates are skyrocketing, and overall healthcare use is projected to keep growing, and we don't really have any way of paying for this.
Well, thank you for your insights, but that is all the time we have today. Listeners can keep up with this story and more at thecentersquare.com. For Kenneth Schrupp, I'm Eliana Kernodle. Please subscribe, and thank you for listening. Audible is a great way to gain access to an ever-growing selection of audiobooks. They've got what everyone's listening to: bestsellers, new releases, that story you've been waiting for. Follow the link in our show description to get 30 days of Audible free.